got a couple of announcements to make. I'm joined on my far left by Ben Carter, the COO at Trinity Health, Danita Cheatham, the Director of Community Engagement for the Detroit Medical Center, Wright Lassiter, the CEO of the Henry Ford Health System, and Dr. Rob Dunn, who I think you are getting to know as the Medical Director for the Police and Fire Department. I want to start today with what I left off at this afternoon with Chief Craig, and I told you we would come back and fill you in on the details of the loss of 2 members of this department in the last 48 hours has certainly got everybody preoccupied. About 2 weeks ago, we moved Dr. Dunn, who had historically been the medical director for the fire department, and firefighters and EMTs are engaged with people with communicable diseases 365 days a year. There is a high degree of medical oversight in their interaction. We realized that with what was happening with COVID-19, we needed that same kind of expertise with the police department, and Dr. Dunn started last week, got testing programs, as I mentioned earlier, with Dr. Phil Levy and Wayne State University. Got a lot of our officers tested, which was enormously helpful, and has been rapidly putting a program in place. I'm going to let him talk about it a little bit, but for our officers, here is what you can expect in the next couple of days. We want to be in a situation that when you come to work, you are greeted by somebody who takes your temperature, that if your temperature is over 100 degrees, we will immediately have you assessed by a medic team from the fire department. If you need to receive medical care, we'll get you immediately to a doctor or a hospital. If not, we will get you promptly to a testing site. And as I mentioned today, one of the holes in our system in the state has been the lack of prompt testing. And I am very pleased that Wright Lassiter this morning has agreed that Henry Ford Health System will take up to 20 officers a day into immediate testing and get prompt turnarounds. If our officers are healthy, we need them on the streets. If our officers are not healthy, we need to get them the best care possible and make sure that they're taken care of. And so, Wright, thank you.
You're welcome.
For that commitment. So the pieces are changing quickly. If an officer is off, there will be a symptom check daily. Somebody will be calling that officer to see how they're doing. If their medical condition is getting worse, they'll get immediately to Dr. Dunn. We will track the status on a daily basis of every one of their tests. And the first day that they are well and past quarantine, we will get them back to work. And these officers are anxious to get back to work. And if they need hospitalization, as we have learned recently, some hospitals in this area are over capacity and are essentially having to triage people out. Other hospitals still have capacity. We're in touch with all of them every day, and if an officer needs to be hospitalized, we will work among the systems and make sure that there is a place. That's our responsibility. These officers are keeping us safe every day, and it's our responsibility as the city leaders to do everything possible to keep them safe. And with that, I want to turn it over to Dr. Dunn. And Doctor, if you could just take folks through an outline and to the men and women of the police department, and of course to the fire department, who you've been supervising for some time, what they can expect to see.
So it's really important to make sure we're taking care of our own and putting our health and safety of our responders at the very forefront of our concerns. So there's a number of things, and I spoke about some of this yesterday, and the mayor was talking about some things, but let's just talk about this. So every single person, whether they're at work or at home, are going to be using symptom screening forms. Those symptom screening forms and checking their temperature will help to trigger additional evaluation on every one of those forms. For members that we have in quarantine or in isolation at home who are ill, we will be following those in quarantine to see if they develop any symptoms. For those who already have symptoms who are in isolation, we'll be following their symptoms, whether they're getting better, whether they're getting worse, whether they're staying the same. Sometimes this will actually involve multiple contacts per day if someone is in a changing situation, and that care coordination piece is vital. We've worked with all the local healthcare systems to be aware of capacity, to be aware of challenges that can change hour to hour, to make sure that all of our employees can get the care that they need. In addition, as any new cases are identified, we'll be going through those steps to assess them. We have deployed now for almost 2 weeks an EMS team specifically for all the employees who can do some initial assessments, take some vital signs, and help coordinate care. If someone's sick right now, we want to get them right to the hospital and get them cared for. If someone is ill but is very stable and can be monitored at home, we want to make sure we're getting that testing done. And that testing piece is very important because there are still lots of different things that make people sick, so we really want to get that test done and then continue to track those patients. With the IT department of the City of Detroit, we have improved our tracking and ability to see what all our patients are doing at any given time, and that is also really important. I appreciate their efforts on this because this is a rapidly changing situation.
So that is an overview, and our officers will be experiencing this in the next 24 hours as they come in, and we'll work through the processes until we have them working smoothly. But again, I appreciate the fact that we put out pretty much a full deployment of vehicles again today, and the dedication of this department is remarkable. Starting Friday, we are finally going to do what I've been anxious to do for a while, which is large-scale drive-through testing. This has been a huge problem. Every day I hear from people, how come only the celebrities are getting tested? I've heard from doctors, how many hoops do I have to go through to get somebody tested? And there are a lot of doctors in this state who have had people they felt deserved to be tested, but because there have been so few labs and so little supplies, that the state has basically had to squeeze that testing out. Really, nobody in the country has been doing the kind of testing that we should be doing except New York. And there's a reason why New York's got 30,000 identified cases and everybody else is at 1,000 or 2,000. It isn't that other places don't have many more cases, it's that New York is actually testing. And we've talked about this before. The one country in the world that got on top of this early and was most successful was South Korea, that did the most extensive drive-through testing of anyone. Here was the problem. We understand how to do it. We've got the state fairgrounds with 140 acres right at the center of all of our north, south, and east-west traffic hubs. It was a place where Wayne, Oakland, and Macomb County all touch. The first question was, if you had hundreds of people come through a day, how would you test them? Because you couldn't deprive the hospitals who have critically ill patients in their beds of that testing capacity. So we had to have a means of lab capacity that didn't cut into the hospitals. And second, the supplies are limited. And we couldn't be in a situation where we used up supplies on drive-through testing and had hospitals with critical shortages. And so for the last 10 days, this has been around the clock, and I can't say enough about Beth Niblock and Hakeem Berry and Kim Rustam and Brad Dick and Elisa Millell and the team. But here's what we did. We went to New Jersey to BioReference Labs, and we made a deal that they will test 500 cases a day out of our drive-through testing over and above what the state was getting. We were only able to do that. They're doing a huge share in New York's testing because Jamie Dimon and J.P. Morgan Chase are their bankers, and they weighed in, and with their help, we've bought this capacity. Then we needed to have testing kits, which is still unbelievable to me that we're talking about scrounging for testing kits, but every one of the men and women up here with me are scrounging for testing kits every day. But Dr. Roberto Romero and the Perinatal Research Branch put his people to work all weekend, and they created 6,000 kits for us. And so again, we created the supplies without cutting in to the hospital's ability to operate. Then the question was, how do you find enough staff to take the samples at the site? No one group can do it, and each of these hospitals is going about 18 hours a day. In fact, I probably got 3 of the busiest people in the state sitting up here with me right now, but they realized if they all pitched in together and took a part of it, that we could do this. We know we should be testing 4,000 a day. We want to prove we can do 400, and then as we succeed and the lab capacity and supplies hopefully start to get solved with some help from the federal government, that we will steadily grow this. And so we sat down with the county executives, Warren Evans, Dave Coulter, and Mark Hackel, and said, let's all do this together. Their health directors coordinated with us on this. We've all pitched in together, and all three of them will be reaching out to the physicians in their community, letting them know that the drive-through testing will be available. And as our lab capacity expands, I expect that the three county executives will each open a site based upon our model, and we will all work together. That's how we get to the kind of testing that we're ultimately going to need to get to beat this. And so here is what's going to happen. Tomorrow, you will be able to call up and get an appointment. We will start the drive-through testing on Friday. You are able to call up because Dan Gilbert and Jay Farner and Quicken Loans has stood up an entire call center. There are people who have tried this across the country and had to stop it because 1,000 cars show up at once. We said, we're not doing that. We're going to book 40 to 50 people an hour from 7 in the morning to 6 at night. And so we will space out the cars so you won't see long lines of cars and hours of wait. That's not going to happen. If you have symptoms, in order to get an appointment, you need a doctor's script. And I'm going to keep saying this over and over. If you don't have symptoms, you should not be tested. It's not just a matter of trying to conserve resources, but it's been shown that if the virus hasn't progressed enough to cause symptoms, the tests are not reliable. We have way too many people who are found to be negative in the test in the early stages when, in fact, they had the virus. It is a waste of resources to be tested before the symptoms have appeared. But if you have symptoms, you contact your doctor. If you don't have a doctor, go to the city website, call the health department, we'll get you a doctor. But the city website also lists each of the hospital systems up here. Your doctor confirms you have the symptoms, gives you the script for the test. You or your doctor will call the number 313-230-0505, and the folks who normally would sell you a mortgage will answer the phone. And if you say to them, I want to be there between 10 and 11 on Saturday, and we've got a slot open, they will book you in between 10 and 11 Saturday. If they say we've already got 50 people between 10 and 11, they might book you in between 11 and 12. You show up during that time. You have to be in a car. This is not a walk-up. We'll ask you to keep the windows up. You'll show your script from your doctor. You will be on our iPads with a list of who you are. You won't be able to drive up at random. You cannot get in without an appointment and without your doctor screening you. But if we do this right, we can move 40 or 50 people an hour who will come in off a state fair, come through, be swabbed. We will take the kits, send them by plane twice a day to New Jersey. The way the turnaround is going, we'll have the results back in 3 or 4 days. You go right back out 8 Mile, and you go home and wait for the results. I want to thank Governor Whitmer and Dr. Khaldun, who have worked with us every step of the way on this process. This is a significant expansion of the state's testing for COVID-19. And I know the governor plans to be out to look at this very quickly because as the capacity expands, we need to be doing these around the state. But this has only been possible by extraordinary cooperation. The DMC, Trinity, and Henry Ford team, lab teams, have been out with us going over every step of protocol, every step of the way. The best minds in this region have put this plan together, and hopefully it will work smoothly. So between 9 and 7 tomorrow, you got your doctor's script, you can call. And the call center will be open starting at 9 a.m. tomorrow. They will start booking you for an appointment starting Friday. All the information will be on the city's website. And I can't say enough good about the health systems that are with me. It is unbelievable what they're coping with, and they still had the time to partner in this preventive testing program because it was for the broader good. And I want to let each of them to speak at this time, so let me start with the CEO of the Henry Ford Health System, Wright Lassiter.
Thank you, Mayor Duggan. I'm pleased to be here with you, Mayor, and I want to just thank you for your leadership around this effort. As we've discussed, it's vitally imperative that we come together as healthcare organizations, as community leaders, to address this pandemic. As you mentioned, also want to thank the folks from Quicken Loans and my partners here from DMC and Trinity for all of our collaborative efforts to move this forward, along with our partners at Wayne County and Oakland County and Macomb County. I would just reiterate a couple of points, Mayor. One, we are excited to be part of this because we want to get ahead of the pandemic, and we want to address community health in as broad a way as possible. As a leader of one of the region's largest healthcare systems, we want to make sure that people keep themselves healthy. And so I would just start off by saying that everything you've heard on national and local news around social distancing is quite important. And so we would ask you to practice that. As you know, our governor has implemented her executive order, and we'd ask you to follow that order to keep yourself and your family safe. Mayor, I would also just indicate that, as was reported yesterday and today, the Henry Ford family is extremely saddened by the loss of Marlo Stoudemire, someone who worked for us and did a great deal for this community, and someone who was a personal friend of mine as well. And so, and we also, our hearts and our prayers go out to the police individuals who have passed as well. And so we just ask us all to continue to heed the warnings that you've heard from officials from the CDC and from our local and state government to make sure that you heed that. We'll tell you that Henry Ford is working very hard to ensure that both our staff are safe during this time and that we're addressing the issues that the community needs us to address. I would say that as of 12:30 this afternoon, we had 591 COVID-19 patients across our healthcare system. This includes all of our hospitals, both in the Metro Detroit region and in Central Michigan. And we have another 107 patients who are awaiting their results. And so we certainly are feeling the impact of this. As you can imagine, with Henry Ford Hospital in Detroit being a level 1 trauma center, it is the facility that has the largest impact of COVID-19 patients. And so we are doing what our colleagues are doing, trying to ensure that our staff are safe with personal protective equipment, that we are acquiring supplies to manage the increased demand, and we're creating surge capacity as our colleagues are. We've converted 2 floors of one of our clinic buildings at Fairlane Medical Center to an inpatient unit for COVID patients. We've postponed all of our elective and non-time sensitive procedures. And we've converted a half dozen ORs in our Henry Ford Macomb facility for a COVID-19 ward. And so we're doing the kinds of things that you're hearing about on the news to ensure we have increased capacity. We were excited that on March 16th, we began doing in-house testing at Henry Ford Health System, offering 24-hour turnaround time for results for employees and patients who are coming into our system. And so we continue to ramp up capacity and are excited that we're able to do several hundred per day and would expect to be doing more than that in the weeks to come. I would also say that, as the mayor's indicated, we are experiencing all of the challenges that you're hearing about in the news. Backlog in testing because of access to reagents, significant staff concerns because of limited supply of PPE equipment. We're working aggressively to find sources both in and outside the United States to bring N95 masks and surgical masks in so that all of our staff can wear those and feel safe. And so we're doing all those kinds of things to ensure that again, the community is safe and the workers across the Henry Ford Health System are safe. In conclusion, I would just say again, we're excited to be part of this effort. Mayor, we appreciate your leadership in bringing the organizations together to drive for increased regional testing, and we'll continue to do all that we can to support this effort.
Thank you. I'm Ben Carter. Ben, why don't you talk a little bit about Trinity for people who aren't familiar with it, but the CEO of the Trinity Health System.
Thank you, Mayor. And first and foremost, I'd like to thank you for your leadership in bringing us together in this community effort. It really shows how when a city, the 3 counties, 3 health systems come together to bring more capacity for a community need that's vital, what we can really do together. It is, this is inspiring, and Mike and Mayor, I want to thank you again for your leadership in that regard. I'd echo everything that Wright said relative to preparation. Locally, Trinity is the St. Joe Health System and the Mercy Health System on the west side of the state. But we're taking all the actions across the whole country that Wright talked about. We've set up an incident command center here at the system office, and we cover 22 states, and we are taking this as an incident command approach. So we have an incident command center at each one of our regional health ministries, and we are preparing for a surge. Some of our communities have already been hit, others not quite yet. We learn from each other. We're preparing in terms of bed capacity surge, staffing surge, working to protect our colleagues, our physicians, understanding where some of the critical shortages are relative to personal protection equipment, ventilators, testing medium, as Mike, the mayor, talked about, incredibly, that we're still running short on testing and testing medium, ordering lab equipment so that we can turn around tests in 24 hours or less, and point of care testing as well. We have all of that coming, both for southeastern Michigan and for Trinity and all of our facilities across the country. This is serious. We need to take it serious. We need to heed the warnings of all the governors, and Governor Whitmer, thank you for your executive order. Practice social distancing as well. We need to get in front of this. We need to learn from the lessons of other countries around the world and practice best practices as well. So again, for us, it's preparation, it's mitigation, it's spread, it's being able to respond in each of our communities to practice safe practices, and it's an honor again for us, St. Joe's and Trinity, to be part of this community effort. And we believe that this is what we need to do in all of our communities, and this is the first one that we're doing it in. And our expectation is that we're going to roll this community effort out in all of our communities around the country. So, Mayor, thank you again for your incredible leadership.
Thank you, Ben, and my former colleague from DMC, Tanita Cheatham.
Thank you, Mayor Duggan, and my distinguished colleagues here today. I would only be echoing what my other colleagues have said with regard to the challenges the DMC is facing with regard to addressing this. But know that the DMC is and has implemented the appropriate measures needed to be implemented in order to address this from a safe staffing perspective as well as from a patient perspective. As new occasions teach new duties, we're in a new world. With a flip of a switch, we're in a new world. We are honored to be on this coalition to address the needs in the community. More than a four-walled institution, I think I can speak for my other colleagues when I say healthcare starts in the community. And so working in collaboration with you all in this effort is something we're proud to do, and we're honored and committed to do it.
So you can see we got quite a team, and I'm confident we're going to execute competently on Friday. And with that, we'll take any questions.
Your Honor, I see that there's a, in your press release, it says that individual.
If you're the patient, but if you have the script yourself, you can call us. We will ask you the name and the phone number of the doctor with the script, and then we'll book you. You're going to have to show us the script when you show up, but we won't stop you from booking. As long as you've got it, we will book your appointment.
And given that the Tri-County area has donated, been so involved in establishing this, will people from surrounding counties be welcome to this, or is this limited to their residency?
We're going to start by the doctors, we're going to go by doctor's orders. And if we end up over capacity, we may make some decisions, but our intention is that if a doctor gives us an order that this patient needs a test, and of course, we will, like everybody else, monitor usage to make sure one person isn't abusing, but no, we're just going to respect the doctor's orders.
Mayor, considering that there is a significant amount of the population that don't own cars, where kind of precluded from a drive-through testing scenario, what solutions are available?
So we have been out visiting through our housing and revitalization department, 30-some different centers where people who are more transient are gathered. We have a number of outreach programs through our district managers, but I would say to everybody, whether you have a car or not, call your doctor. Your physician's office a lot of times can work out a ride, and if somebody calls and says, I really need a test, I don't have a ride, we got folks who will do that. But that's true today. You can call your doctor's office, and I don't know, right, what happens when somebody calls up and says, I don't have a ride to the office and I'm in bad shape? They call 911?
They do, and in some cases, frankly, we have support for ride assistance, depending upon the circumstance of the patient. And so through our social services area, we have support for that in some cases, so.
And you guys have the same thing?
Yeah.
We do.
So the answer is call your doctor if you need ride assistance and work that out. And if you need ride assistance and you still can't do it, call our health department number. We'll work it out.
And how long do you anticipate people will be waiting in these drive-through scenarios?
I would expect no more than an hour. So we're going to book 40 to 50 people an hour, and assuming that we execute this competently, that should be it. We don't expect any traffic backing up onto State Fair. We expect to queue it within the fairgrounds, so we're respectful of the neighbors. Now, I know they've tried this in other places and had to shut it down. We think we've studied what they've done, but we will prove ourselves on Friday whether we've done this competently. But I feel like this has been put together by a whole lot of experts, and hopefully it'll run smoothly. But if you book between 9 and 10, there will be 40 and 50 people booked between 9 and 10. We'll have 9 or 10 lanes of traffic. We expect you to be through in that hour because we have another 40 or 50 coming in the hour behind you.
Will there be police or security on hand to make sure that people won't try and cut the
Yeah.
line, or maybe
Yeah.
someone who's anxious or in distress decides, hey, I don't have any
Yeah.
money, you gotta see me right now.
Yeah, we'll have security in place. We're not taking DPD officers, but we've arranged security.
Hey, was that 7 days a week?
6 days, I'm sorry, Monday through Saturday. So the phone line is open 7 days a week. The appointments are Monday through Saturday.
Will this enhance the amount of tests that are being done by the respective medical centers, or do
Yeah.
you have to divert some resources?
Nope. So I'm not sure how many tests are being done in this state today, maybe 1,200 or so, 1,400 or so. People here would have a better idea than I have. This is going to add another 500 to that. We are purchasing capacity out of New Jersey, and it will be a major expansion of this state's testing capacity. Now, I think there's a number of folks, including at this table, who are going to solve our lab testing capacity in the next few weeks. This gets us a bridge period until they can do that.
You mentioned sending the results to New Jersey and taking 3 or 4 days to get results. Is that an average time span for 3 or 4 days?
They tell me right now, BioReference Lab has just done an outstanding job. They tell me right now that they are getting a 2 to 3 day turnaround on their tests. It's going to take us a day to fly them out there. So we're trying to be a little bit cautious, but we're confident that in 3 or 4 days, they are by contract, have to get it to us in 4 days, but they're running a day or two better than that this week.
Mr. Mayor, given what we heard today about social distancing, there seems to be some debate at the national level, maybe just involving 1 or 2 people who spend the night in the White House, that we can reduce the distance between people, and that maybe social distancing will run its course by Easter. Is that the position of folks here in Detroit?
You know, 4 people connected to me have died in the last 48 hours. The 2 public servants at the police department, Marlo Stoudemeyer and the brother of one of our senior staff. That's the last 48 hours. We haven't hit the peak in Michigan. It's not clear they've hit the peak in New York. And the idea that you would just go on with life and survival of the fittest, whoever doesn't make it, doesn't make it, to me is not what this country is about. I think the governor is doing exactly the right thing with social distancing, and I can't say this any more strongly. People that are ignoring this and are coming together in crowds, you are going to cause the death of members of this community. This virus cannot spread if we don't come together closely. It will die off by itself. It is the people in crowds that are perpetuating it, and it's inconceivable to me that we'd make a decision, that we go about our lives and just go to funerals. That's not my idea of the kind of city or the kind of country we want to have.
Mr. Mayor, in New York, the governor has created a facility, a preparing facility at the Javits Center to deal with this crush. And some could argue that the crush is already there. Has the city identified a similar facility, or is there an effort right now
Yeah.
to identify a facility where we might be able to replicate that?
So Governor Cuomo's just done an outstanding job, and Governor Whitmer has started that process as well. I've been in contact with her emergency planning team, and we are looking at a number of potential surge sites. You heard some of the individuals here talk about the fact they're converting office spaces, operating rooms, et cetera, to beds. Could we someday see the TCF Center or the Pistons practice facility or the Marygrove dorm turned into hospital beds? Those are all things that the governor is appropriately exploring, not just in Detroit, but around the state. But surge capacity is something that we're all talking about, and I'll turn it over to any of my colleagues here to talk about how you're thinking about that.
Well, I would just say that, as you heard from Ben earlier, that all the healthcare systems have engaged incident command centers to think about this as a mass casualty event, and so we are planning for surge capacity. Hopeful that we don't get to the place where New York City is, but we are planning for that, and so I think all of us have planned alternate sites, converting ambulatory facilities into inpatient facilities. Henry Ford has had conversations with 4 different facilities about the potential to utilize fairly large capacity public places for our use, for a combination of either caring for large numbers of individuals and or providing hoteling effectively for staff as you bring in staff to go through shifts of work where they need to be very close to the workplace. And so some of them that the mayor has mentioned, and there are others that have not been mentioned that we are currently talking with and making contingency plans if we had to take those steps.
I would just add that, again, this is working with the governor and her team and the Michigan Hospital Association and other community planning organizations, because this really is planning together as a community. And in a couple of other regions that we operate in, we have in fact worked with the states to put up mobile hospital units, 25 beds in Hartford, Connecticut, 100 beds in Fort Lauderdale. So those are options that are available to us as well, also in the state. But this is why planning together becomes so absolutely critical to do this as one. We don't compete as health systems in the time of crisis. We really come together as one, and that's really the pride I get of being in healthcare every day.
I'm sorry, I do not have that number as of right now, but it's not as high as my fellow colleagues, but we do have them. Sorry, I don't have a better answer. At this time, they're not releasing them, but at some point they will be.
So, Mr. Mayor, if I understand you, something similar to what's being done at the Javits Center would be arranged at the state level rather than at the local level.
And so we are collaborating, but I think what you will see is the state is taking the lead. The governor and I and Dr. Khaldun and I are on the phone constantly. Everything we are doing is being done together. And I have told them they have my full support at any facility they want to use that is most appropriate. I still think like a hospital executive. And if I were sitting where they were thinking, I would be looking for large space I could partition that has bathroom facilities that I could manage. And then you get into the second question, how do you staff it, which will be even a greater challenge than the space. But I am supporting the governor 100%. I can tell you that her planning people are doing an excellent job preparing.
I have a question for Dr. Dunn. Can you talk about how many emergency service workers right now are in quarantine and what that number is expected to look like over the course of the next week?
I don't have those numbers in front of me. I can tell you there are a number of people that are in quarantine. People have been coming out of quarantine because we've had exposures occurring for a while. And everyone who's in quarantine is being monitored for symptoms. In addition, we do have some people who are isolated because of their symptoms. We have people who are awaiting test results, which will help us to guide when we can get them back to work, but I do not have the numbers in front of me.
I think Eric Jones released them earlier today for the fire department. I think John can get them for you.
Your Honor, we're at police headquarters, public safety headquarters. Has there been any indication whether or not crime has increased or decreased, or if there's been any change in sort of ebb and flow of things since Detroit was paying?
In the last week, it's been down a little bit. Before that, it was up. January and February, it was up in particular. But the last week, it's down a little bit. Our police officers are still making 911 runs as of yesterday in really historically low times, which means that the call load is lower and our officers are showing up for work. But we're not seeing a surge in crime. If anything, it's dropped off a little bit.
But you haven't noticed anything precipitous where there's sort of
No.
people are now in their houses and so there's
Yeah, I haven't studied it exhaustively enough. I can just tell you that looking at the numbers in general and looking at the police response time, there certainly has not been a surge. Has there been a significant drop? I haven't seen that, but we can get you those numbers. But I'm quite sure it's going to show you there's a slight drop. Anything else? All right, thank you all very much for your time.